Patient trust is quite important if you are a healthcare organization. How can branding be used effectively to build patient trust towards your brand?
Build the foundations first. Get alignment, internal alignment of what the overall vision, ambition, purpose, values, etc. is of the organisation. And then what does that mean for your audience, right? So you need to create a compelling brand narrative, a brand story that talks to the people that matter. And once you have your strategy in place and everyone agrees with it and everyone's on board, that's when your marketing becomes more effective, and that's where your campaigns, when you're talking to patients or employees, becomes easier, because all the foundations and the tone of voice and the messaging framework's already been delivered, so that it makes it really easy and efficient for these organisations to make an impact with their marketing campaigns, whatever that tactic that they're deploying. The work that we do feeds into that and makes it easier.
How can a healthcare organization such as NHS use branding to leverage patient satisfaction as well as care quality?
Well, first and foremost, I think it comes back to listening and them speaking to the people that matter, the people they serve, the employees. Firstly, understanding kind of what their expectations are of the NHS, or that trust in particular, and then communicating that in an honest and authentic way. Don't overpromise if you can't deliver on those promises.
And do you think maybe sharing success stories?
Patient stories as well, not just kind of innovation or technology that you brought to your trust, but engaging with your community, the people that you're serving, and asking them for honest feedback. And let that also inform how you can improve your organisation and the services that you provide.
So when you're working for an organisation such as NHS, and for instance, they ask you to create, they said, look, Gary, we have a problem. Our branding isn't great. What can you do?
When branding comes into play for NHS Trust, it's more about the messaging and communicating kind of like, we're here for you, we're serving you. When you look at other aspects of the NHS and certainly the projects that we've been involved in, it's almost more about supporting the employees. That's where the branding is really strong, because the NHS looks the same wherever you go in the country, but when you work on employer branding, you have a bit more creative license to kind of communicate the kind of philosophy and ethos behind that trust, that organisation, in a different way. We've done that with Healthy Together Network, East London NHS Trust as well, through various different brand communications. So the identities for NHS that we create and the brands that we create for them are more inward looking as opposed to public facing. The work that we do for the NHS that is public facing is more general brand communications, about communicating you can come here for specific problems, health or mental health problems.
Rachel, what advice would you be able to give an organisation in the healthcare sector who have these issues with their branding and looking to improve their branding?
The advice I give is trying to sort of hone down what they think the real problem might be. We can look at them as a whole, or we can look at specific parts of what they need, but sometimes they don't know what they need. They know they've got a problem, but they don't really know what that is, and we can help. So they can just contact us, have a chat with one of us in the office. Yeah, we just kind of collaborate with them, get together and have a chat and find out what it is that they're all about and what they think they need, and take it from there, really.
When they work with us, they don't come to us and say, we're going to rip that up and start again. We'll review where they're at today, what they're trying to achieve, and identify what's working, what's not, and give our recommendations on how we can evolve their current branding for whatever purposes they've created it. Then work with them to create them with essentially a communications toolkit that enables them to talk to, audience A, B, C, D in the right way, at the right time, in the right channel.